Welcome to the 2020 Tribal Health Virtual Town Hall. This year's theme is Standing Together During the COVID-19 Pandemic. I'd like to extend a very special welcome to tribal leaders, first responders, and elected officials who have joined us this morning. My name is Maria Dadgar, and I serve as the Executive Director of the Intertribal Council of Arizona. I'm honored to serve in this role. I've been serving for the past 6 years as Executive Director, and I report directly to the highest elected officials for 21 of the 22 tribes in Arizona. The Intertribal Council of Arizona, or better known as ITCA, has 3 primary focus areas that we focus on, and that's health, environmental quality, and research. It is my great honor to serve as your MC today. I'll try to keep it fun and I'll try to keep us on time. This past year has been one of the most difficult years in our nation's history. With the onset of the pandemic, it started just spreading across the United States and hitting our tribal communities very severely. We've all had sicknesses going through our families, and we've all lost loved ones, and it's been a very challenging year. In fact, we almost decided to cancel the town hall this year because of the pandemic, but then we realized that this year, more importantly than any other year, would be the time for us to hold this event and have this opportunity for everyone to have conversations around these important issues. This is a time for you also to ask questions. And so I have a few housekeeping notes to go over, and I'll give you a little information on how everything's going to work today. So before we get started, just 4 housekeeping items. So number 1, please use the call-in number you received in the confirmation email if you're having audio issues. You can also email events@azblue.com for assistance. One of Blue Cross Blue Shield's technical staff will respond as soon as possible. Today is a blended learning format that will provide both pre-recorded and live presentations. And finally, to make today's events interactive, please submit your questions using the question and answer box. Note that not all questions will be answered live. However, a question and answer recap document will be posted on the post-event landing page. So those are our housekeeping issues. I have a few more later in the program, housekeeping items, I should say. To start off our day with a blessing, I would like to introduce Councilman Tom Largo of the Salt River Pima Maricopa Indian Community. And in just a minute, I'll ask Tom to get started with the blessing. But first, I wanted to share just a few paragraphs from Tom's extensive bio. Councilman Tom Largo is in his 21st year of serving as a councilman for the Salt River Pima Maricopa Indian Community. Over the years, Councilman Largo has been involved and dedicated to developing Salt River's business corridor, which has provided revenues for the tribe and created hundreds of jobs for community members and the surrounding cities. Prior to serving on council, Mr. Largo was a business agent for the Ironworkers Local 75 from 1977 to 1991. Councilman Largo has served as a board member for many organizations, including Salt River DevCo and the Miracle House Foundation. When not working, Mr. Largo devotes time to his church, his family, and his community. At this time, I would like to call on Councilman Largo to give this morning's blessing. Councilman Largo?
Thank you, Maria, for that those kind words. And to all of those in the audience, join with me as we pray to the one that has given us life. Our God and Father, as we come before you this morning, we're grateful. We come in a place of humility. First of all, we would ask that you would cleanse us of all unrighteousness. Make us worthy, my God, to be able to approach a holy and a mighty God. At this time, Lord, you know the pandemic that has hit this world, this country, this state, communities throughout the state of Arizona. You know, there's one thing that you have assured us of, Lord, that there is a time for everything and a season for every activity under the heaven. And Lord, we're going through that at this time. There's times of joy and there's times of sorrow. There's times of happiness. And Lord, at this time, no matter what we go through, we do know one thing, that you are in control. Because you're an all-knowing, ever-present God, there's nothing we can hide from you, or should we want to. As we come before you this morning, we ask that you would put a shield of protection around our men and women that serve in the armed forces throughout the world. Be with their families, Lord, as they're away from it this time. Be with our first responders, our men and women in police departments, Lord, in fire departments, those in the medical arena, Lord, that are out there at this very moment. All of them, Lord, are doing their best to utilize the gift that you've given each and every one of us. Everyone at this conference, my God, has been given a gift. And that gift is to serve mankind. But even more than that, we've been given life for one reason, and that's to glorify you, to honor you, and to praise you. No matter what we go through, my God, we know that you're always there. And that's one promise you've made to us, that no matter what we go through in life, you will never leave us. If we will just put our faith in the one you sent to this earth to show us a way to live with our fellow citizens, Lord, to have compassion when they're hungry, to feed them, when they're without a place to live, Lord, give them shelter. And at this time, it's probably we will experience even more. But the assurance that we do have, Lord, in the time that you've given us, that if we will follow your words of wisdom in that great book that you have given us, Lord, the Bible, if we will follow those guidelines and do everything that you have showed us, we will be assured that life does not end here. It does not end here. But we want to be able to stand before you and just thank you for the time that you've given us and spend the rest of our eternity with the holy and mighty God. I ask at this time, Lord, that each one that's in this attendance, that you would not only put a shield of protection on them, put one upon their families, because we've had losses, Lord, and those are hard to overcome. But we do know this, Lord. We do know this, that you are a loving and a caring God. Even sometimes when we get in a place of disappointment, we know that many times there's a reason. So at this time, Lord, I would ask you to be with everyone in this conference. Give them the wisdom and the knowledge, Lord. But even more than that, give them a heart and a mind just like yours, so that we can go out and fulfill the purpose for which you gave us life. In Jesus' holy name we pray. Amen.
Amen. Thank you so much for those very meaningful words, Councilman Largo. We're honored to have you give the blessing this morning. I
Thank
know.
you. I will be departing now, and a blessing upon all of you at this conference, and just share everything that you have for the betterment of mankind. Thank you.
Thank you, sir. Have a wonderful day.
You too.
Whew. Councilman Largo always touches me with his words. Once again, on behalf of the Intertribal Council of Arizona, we're honored to serve as your co-host for this year's Tribal Health Town Hall. And it's been a very challenging year. I just want to say we could not have done this work without our great partnership and our working relationship with Blue Cross Blue Shield of Arizona. And as you know, events like this take so much work and so much planning and preparation and collaboration. And I had a very special team to work with, and I hope they don't mind, but I just want to recognize Christine Bracamonte Wiggs, Geraldine Haskin, and Jessica Yanal, and everyone at Blue Cross Blue Shield. I just want to thank you so much for working with me and helping to make this possible for the Intertribal Council of Arizona. And hopefully we will have a chance to do this again next year under much better circumstances. Now, I'd like to share a very special welcome from the Honorable Governor Doug Ducey.
This is Governor Doug Ducey saying hello and welcome to everyone at the second annual Tribal Health Virtual Town Hall. I want to thank the Intertribal Council of Arizona and Blue Cross Blue Shield of Arizona for partnering to make today's event a great success. Arizona is incredibly proud to have one of this nation's highest populations of American Indians. And we've been blessed through the years by the rich culture and history of each tribal nation and community. The COVID-19 public health crisis has upended nearly every aspect of our lives. And today, my heart goes out to every tribal community member who's been impacted or lost a loved one to this virus. Arizona's #1 priority throughout this crisis has been to protect and save lives. And I'm grateful to all the tribal leaders, health professionals, first responders, community organizations, and federal partners who have dedicated themselves to that mission. Today's event is an opportunity for continued discussion on the best strategies and actions to protect our communities from COVID-19. Thank you all once again for your dedication to improving the health of every tribal member across our state. Enjoy your town hall, and God bless.
Our thanks to Governor Ducey for his welcome this morning. We also have another special welcome for you from Ms. Pam Cahaley. Ms. Cahaley is President, CEO of Blue Cross Blue Shield of Arizona.
Hello, I'm Pam Cahaley, President and CEO of Blue Cross Blue Shield of Arizona. I want to welcome you to our 2020 Tribal Health Virtual Town Hall in partnership with the Intertribal Council of Arizona. I appreciate your leadership and presence here today. COVID-19 has had a significant impact in our communities and across our states, especially our Native American communities. Tribal nations have a rich history in our state, but the pandemic has shined a light on the health inequities tribal communities face. I encourage all of us to come together today to identify how we can strengthen and support the health of our Native American tribes. Through our determined focus, deep commitment, and collective action, we can all work together to inspire health across our state. Thank you for joining us today, and have a wonderful town hall.
Thank you, Ms. Cahaley, for your remarks this morning and for allowing ITCA to have this wonderful partnership with Blue Cross Blue Shield of Arizona. As we move on and starting to get into today's program, our first few presenters will discuss federal and national perspectives on the COVID-19 pandemic and its impact on tribal communities. To start our town hall presentations, I'm honored to welcome Rear Admiral Michael Wiacki, the Director of the Indian Health Service. Due to his schedule, Rear Admiral Wiyaki recorded his message ahead of time to share with us today. In addition to providing his insights, he will also be responding to 2 questions that were previously submitted by 2 tribal leaders. And now we'll hear from Rear Admiral Michael Wiyaki.
Good morning, everyone. I'd like to thank the Intertribal Council of Arizona and Blue Cross Blue Shield of Arizona for hosting this Tribal Health Town Hall. The IHS remains committed to strengthening partnerships with tribes, tribal organizations, and urban Indian organizations, and to working collectively to respond to and recover from the COVID-19 pandemic in Indian country. The partnership between IHS and the Intertribal Council of Arizona is a great example of the cooperation required to address the healthcare needs of American Indians and Alaska Natives. Continuing these partnerships will only build on the success and progress we're making in providing quality care to our patients. That's why it's fitting that the theme for today's Tribal Health Town Hall is standing together during the COVID-19 pandemic. IHS has worked closely with federal, tribal, and local governments and with tribal and urban Indian organizations throughout the pandemic response. Standing together during this time is more important than ever before. As cases of COVID-19 continue to rise, we must renew our sense of personal accountability to protect ourselves and those around us. With colder weather and more people staying indoors, we find that pandemic fatigue has been setting in. In order to stop the spread, we must think about alternative ways to stay connected with our friends and loved ones this holiday season. Travel increases your chance of getting and spreading COVID-19. Staying home is the best way to protect yourself and others. Our goal is to slow the spread, decrease hospitalizations, and decrease fatalities while keeping the economy open. The IHS continues to enhance our testing capabilities. For example, as part of the efforts by the Department of Health and Human Services to improve testing access for the most vulnerable segments of the population, the IHS has received and distributed over 300,000 Abbott BinaxNOW rapid point-of-care COVID-19 tests. These tests support the IHS's efforts in tribal communities where there have been recent increases in new cases and hospitalizations related to the ongoing outbreak. Overall, more than 1.36 million COVID-19 tests have been conducted throughout the Indian health system of care, which is equivalent to approximately 82% of the IHS user population, and it exceeds the overall U.S. general testing rate of 57%. With regards to a potential COVID-19 vaccine, we recently released the IHS COVID-19 pandemic vaccine plan. As we get closer to an FDA-approved vaccine, this plan details how the IHS healthcare system will prepare for and operationalize the vaccine. It also provides important guidance for all IHS federal, tribal health programs, and urban Indian organizations that choose to receive a COVID-19 vaccine coordinated through the Indian Health Service. The IHS National Supply Service Center has a long and successful history of coordinating and managing the distribution of pharmaceuticals, medical, and other healthcare-related supply items to our ITU programs nationwide. In addition to the COVID-19 tests that I mentioned earlier, the IHS Supply Service Center has distributed 78 million units of personal protective equipment and over 2,100 vials of remdesivir and 1,800 doses of bamlanivimab throughout the Indian healthcare system. To enhance patient care during COVID-19, the IHS formed a critical care response team composed of expert physicians, registered nurses, and other healthcare professionals that can provide urgent life-saving medical care to COVID-19 patients admitted to our IHS federal or tribal hospitals on an as-needed basis. I want to acknowledge this team for their hard work and response efforts that have helped to make a huge difference throughout the Indian health system. To date, the team has deployed to 11 tribal and federal sites including to the Cells Hospital there in Arizona. They've helped to expand capacity to treat our patients and also train our frontline healthcare professionals on the most current clinical information available to help manage COVID-19 and other critically ill patients. Before I close, I'd like to remind everyone that with flu season upon us, it's important to protect yourselves, your family, and your communities by getting an annual flu shot. It's especially important during the COVID-19 pandemic to reduce the overall disease burden, as well as any unnecessary stress on the healthcare system by decreasing hospitalizations and reducing influenza diagnostic testing demand. I appreciate all the work that all of you do to promote Native health and your continued dedication to supporting the IHS mission of raising the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. Again, thank you for this opportunity to provide remarks here today. Please stay safe and continue to take responsible actions to stop the spread of COVID-19 by following the 3 W's. Wear a mask, wash your hands, and watch your distance. With that, I'll turn it back over to our moderator. Thank you.
We have a few questions. We thank Admiral Wiyaki, and we do have a few questions that are on the screen now that Admiral Wiyaki will be responding to. And so I believe you can see them on your screen.
COVID-19 is still a relatively new disease, and there's a limited information regarding risk factors for severe disease. Based on currently available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at a higher risk for severe illness from COVID-19. These conditions include chronic lung disease or moderate to severe asthma, serious heart conditions, and people with diabetes. We do know that there are a number of challenges that we face in delivering healthcare, especially at facilities that are located in some of the most rural and remote locations in our country. The COVID-19 pandemic has been especially challenging, and it's not uncommon for our patients to have to travel 3 or 4 hours by car to receive healthcare. Our goal is to ensure that comprehensive, culturally acceptable personal and public health services are available and accessible to all American Indian and Alaska Native people. Also, our patients often live in multi-generational homes and are overall a very close-knit community. Large gatherings are a part of our lives, and so when a highly transmissible infection moves in, it circulates even faster. A recent CDC Morbidity and Mortality Weekly Report included data from the Hopi tribe that showed that frequent and recurring social interactions among extended family members permitted repeated exposures to infectious persons. In communities with similar extended family interaction, emphasizing safe ways to stay in touch, together with wearing a mask, frequent hand washing, and physical distancing, might help to limit the spread of disease. Another way to continue improving overall health of American Indian and Alaska Natives with regards to long-term outcomes is through the IHS Special Diabetes Program for Indians. Congress established the SDPI in 1997 to provide grants for diabetes treatment and prevention services for IHS federal, tribal, and urban Indian health programs across the country. There are currently 301 SDPI grant program sites in 35 states across all 12 of our IHS areas, who collectively are serving more than 780,000 people. These programs continue to successfully implement evidence-based and community-driven strategies to prevent and treat diabetes. For the first time, diabetes prevalence in American Indian and Alaska Native adults has decreased and has done so consistently for 4 years, dropping from 15.4% in 2013 to 14.6% in 2017. Neither the general United States population nor any other U.S. racial or ethnic group has shown a decrease in prevalence. Given that diabetes-related mortality has also decreased, this improvement in prevalence appears to be driven by a reduction in new cases of diabetes in Native adults. These improvements have huge implications for quality of life and healthcare costs. Sustained efforts in diabetes prevention and treatment are critical to ensuring continued advances in the health of Native people. The SDPI has been and continues to be key to this remarkable progress.
Our second question for Rear Admiral Wiyaki.
As has been true across the entire healthcare industry, the COVID-19 pandemic has precipitated a very significant expansion of the use of telemedicine technology to provide services in Indian country. In April of this year, IHS announced the expansion of telehealth services during the COVID-19 response to ensure that our frontline IHS providers responding to COVID-19 have maximum flexibility to provide the care that patients need. Telehealth services means that patients can stay at home and reduce the risk of infection, while also keeping healthcare workers and others in waiting rooms and emergency departments safe from COVID-19. Telehealth also gives providers access to services from locations other than hospitals and clinics, as in the case of self-quarantine clinicians. Providers can continue to practice medicine and remain available for their patients, and they can also consult with their colleagues across the Indian health system. IHS facilities rapidly ramped up virtual care services from a pre-COVID average of about 530 visits per month to well over 33,000 visits per month between the months of April and July. This represents a 63-fold increase. Between 75 to 80% of these encounters have been conducted using telephone only, and we do not yet have data on the specific range of services covered, but the scope is broad. As reported by one IHS provider, the public health emergency transformed telehealth from an optional service delivery modality to an absolute necessity practically overnight. The conditions identified as risk factors for COVID-19 were essentially a bulleted list of our everyday patient profile. Telehealth has allowed us to continue taking care of our patients without increasing their risk of exposure. Not only have we been able to maintain patient care, but we've drastically improved access and expanded our scope of services. The organizational capacity of telehealth prior to the public health emergency at that provider's facility was approximately 3 to 4 departments engaged. They now support approximately 21 departments that offer telehealth services. A large portion of our patient population is located in some of the most remote and rural locations across the United States, so telehealth is our opportunity to close that gap. IHS has found telephone calls with patients to be very valuable both prior to and during the pandemic. Phone communications are critical to support patients located in bandwidth-constrained environments of Indian country where direct-to-home video consultation may not be possible. The IHS has always used telephone as a modality to support patient care and will continue to do so after COVID-19.
Our thanks to Rear Admiral Wiyaki. We appreciate his service and dedication to tribes across the United States, and we thank him for taking the time to record this message with his busy, hectic schedule that he has right now and to be able to join us this morning. Now, I'd like to introduce our very special guest, Dr. Larry Corey. Dr. Corey is President and Director Emeritus of the Fred Hutchinson Cancer Research Center. Dr. Corey also leads the COVID-19 Pandemic Prevention Trials Network. He will share with us his experiences as one of the experts on the front line of developing the COVID-19 vaccine. Dr. Corey will also respond to 2 questions previously submitted by tribal leaders.
Good morning, tribal leaders, tribal health professionals, and our future healthcare professionals in training. Welcome to this conference. I'm delighted to join you this morning for the second annual Tribal Health Virtual Town Hall, presented by the Intertribal Council of Arizona and Blue Cross Blue Shield of Arizona. It's wonderful to see this kind of collaboration between the Tribal Council and Blue Cross Blue Shield, major healthcare insurer. Throughout this past years in responding to the pandemic, I've really been able to see many inspiring new healthcare collaborations. And this one, this unique collaboration between the tribal nonprofit organization and a major healthcare corporation, is really one of the most novel and innovative that I've seen in a while. Now, across the United States, unique health circumstances and environmental factors have affected how COVID-19 has impacted different communities. As we begin to mobilize and face the challenges brought by the pandemic, we're faced with a very significant impact that the public health emergency was having on the American Indian and Alaska Natives throughout the United States. COVID-19 magnified in dramatic fashion and brought into sharp focus health inequities that tribal communities face. Within Arizona itself, the 22 tribal nations reside within rural communities for the most part. And tribal communities are faced with challenges such as limited access to quality healthcare and infrastructure, difficulty in isolation, and coping with the kinds of both facilities and equipment required to manage this kind of epidemic. One thing we learned is that in every daunting experience, we must collaborate and lean on robust and diverse thinking to develop working solutions. So unique collaborations such as this one, the Intertribal Council of Arizona and Blue Cross Blue Shield, should be used to enhance our ability to ensure culturally responsive public health initiatives and activities that are informed and represented by the interests of tribal communities. Tribal communities can better own and translate working solutions into community solutions when they're partners in the journey to develop a public health response to COVID-19. And I'm excited about this collaboration and the results it will undoubtedly deliver to tribal communities. You know, the pandemic has brought into sharp focus, as I said earlier, this health inequity issues. We've seen with amazingly, surprisingly force of infection what this virus has been able to do. Its high transmissibility, its lethality, its ability to interrupt everyday life in a way that, frankly, we as a nation and you as a community have not experienced in lots of generations. It's been, I guess, a learning experience for all of us with respect to see the rapidity of what has taken care. And it's exposed some underbellies of that we sort of knew existed but come into existence and have, you know, real life manifestations right in front of us. And out of that sort of dismay and at times grief with respect to the rapidity of what the disease itself does and its effects on communities, the deaths and loss of our elders and our loved ones, to all of us. But out of this, there must become some sort of understanding to sort of how do we make things better. Now, research is one way of thinking about, one tool about how to make things better. Now, unfortunately, the mirror of our country reflects, you know, some poor, maybe even unethical past underscorings about having a reciprocal and transparent relationship that research has had in health care in many of the tribal nation communities. I guess I'm here to say that it's only through admitting this and changing the process of research that one can move forward to get the benefits of research. We need action to address the mistakes of the past and just to set up systems so we don't make those mistakes. To ensure that anything that is done from a research point of view, whether that's a basic research or what we're probably more talking about of either clinical trials research or implementation research. That it's done for not only the well-being of the individual, but the well-being of the community, and that be a lasting well-being. And this is only done by involving communities in every aspect of the research process, from the thought about what's going to be researched, how it's going to be researched, and who's going to be part of the research team. I'm an incredible believer that that the people doing the research need to come from the community upon which the research is being done. And that's the best way to ensure that the research process actually lifts the water level of the thought of what you're trying to do. For HIV, it is to improve care. For TB, it's to improve care. For hypertension, to diagnose it early and to treat it and prevent the complications. That's what it is for all disease. And for this one, for COVID-19, really it is about participating in vaccine studies of vaccines that will prevent complications of the disease. We have, after all, had in the last month 2 announcements about vaccines that have 95% efficacy in preventing symptomatic disease, and more importantly, 95% effectiveness in preventing severe disease, i.e. death and hospitalization and getting on ventilators. So understanding how these vaccines work in the tribal communities, understanding how they could be used and implemented to improve the healthcare of tribal communities is an important issue. It's an important issue for the country, and it's important issues for the tribal nations. So I'm optimistic about this kind of engagement and the kind of discussions that will go on in the next day or so to look at the kinds of solutions that are needed to bring better control and hopefully prevention of all infectious diseases, but certainly for COVID-19. American Indian and Alaska Native communities have remained resilient in the face of public health challenges by preserving and trusting in tribal cultures and the values passed from one generation to the next. I'm told in tribal communities there's a concept of 7 generations, meaning that what you do today will impact or influence the next 7 generations to follow. By taking part in today's tribal virtual town hall, you're taking action to gain new knowledge, share your expertise with one another, and inform the public health response. So I'm asking the young health professionals in training to whom these values and tribal cultures have been entrusted, be trusted and credible voices by sharing information on how tribal communities can become part of the solution, such as, like I say, participating in the phase 3 COVID-19 vaccine trials, or participating in trials of having better understanding about how the disease is transmitted throughout the community, as well as in how to inform, better care and improved outcomes of people who develop infections.
Dr. Corey also responded to the question. I believe you can see it on your screen.
Of course, it's impossible to predict the future, but I think we can expect and have seen the introduction of new infectious diseases into our communities. Whether that has, in the tribal nations, it's been Cinnobre disease, as well as now we have COVID-19. But we have seen the interactions between animals and humans, and as we alter the environment, we see the emergence of organisms that are either new or have been here in localized areas that emerge upon us because we've invented something that's essentially invaded their territory and now come to us. We call these emerging and re-emerging infectious diseases. No one could predict that any of them would be this conflammation of new organism, aerosol spread, high infectivity in humans, and significant morbidity and mortality, let alone the economic consequences that it would have. So one needs to think about the issue of how can you prepare for something that you don't know will happen. I think in many respects, that's all about building an infrastructure that allows you to respond, building healthcare facilities. If we look at our response in building the COVID-19 vaccine network, it was the HIV infrastructure of developing HIV vaccines that we did, but not only in the United States, but throughout the globe, that has allowed us to build the infrastructure to use that for COVID-19 vaccines and allowed us to do these vaccine trials in like 4 months, because we had built 20 years of infrastructure of how to handle infectious diseases and how to do vaccine trials and how to build clinics that can have multiple purposes and multiple uses. We knew how to handle aerosolized diseases because we had done research in TB. We had developed nurses and clinicians and respiratory therapists to handle the complications that we were seeing of infectious disease. So I think it's this sort of infrastructure planning that is not just facilities, but it's people. It's the people who know how to do things, the people who can communicate and solve problems and work with communities in solving problems. Implementing things that will have widespread interests. I think this is a key aspect in sort of thinking and doing strategic planning for healthcare, but it's probably for all the infrastructure, electrical supplies and water supplies and generators and telephone communications and computer networks that work in crisis. And I think these are the things that are important and have cross-planning purposes to use research to raise the water level of the entire infrastructure of the community.
We have one other question for Dr. Corey. I'll read it. We understand that the pandemic was especially impactful within tribal communities because we have a number of underlying health issues. In planning for the future of our tribal communities, can you recommend a few priorities that we should include in our plans that can help improve the overall health of our entire community?
My thoughts about this very interesting and thoughtful question is in two arenas. To impact healthcare requires both better facilities as well as person resources that are interested and devoted to healthcare. I think both of them are needed to raise the water level and answer Vice Chairman Sean Lewis's question of what's our priority? Our priority can't just be in buildings, of getting a facility that is more modern or has more room. Certainly having that facility, having stable electricity, having stable oxygen, having the kinds of machines that are required to be utilized for diagnosis and therapy is needed. But most important are the people who run the machines, who know how to use the machines, who can do diagnoses, who can do treatment, who are experienced, and who can help the communities in health and preventive health and in educational health. All these things, from preventive services to acute therapy to chronic therapy, these are people-intensive issues. And I think the biggest priority actually is building this human resource infrastructure. Usually that takes a decade to train somebody from to get into a profession or into an occupation, and for them to get good and to practice and to come from the community and return to go out for training and come back to the community, or develop a training program within the community. I mean, I think these are the things that are needed for any local health issue. You know, I've seen a lot of this in my career in the area of global health, where I've had the privilege of working in Africa and working with African communities, and seeing that in essence, really global health is local health. We can learn a lot from them by how to use the available resources effectively on a community-wide basis to come up with creative solutions, especially in areas of prevention and education, street theater, and taking young people and identifying them and putting them into the healthcare careers that interact with the community and stay in the community. And I think that's one of the potential solutions and strategic thinking that would help establish the priorities and answer this question. Let me end by thanking you for inviting me to share remarks for today's Tribal Health Virtual Town Hall meeting. I appreciate the ability to be a substitute for my good friend, Dr. Anthony Fauci. It's been a privilege to work with him in developing and coordinating the program of COVID-19 vaccines for the US government. It's been our goal to bring collectively multiple vaccines to our country and to the tribal nations to be able to use to prevent us from the major complications of COVID-19 disease. It is in this context that we would like to hope that we can share solutions with you and do what we can to promote the health of all tribal members in Arizona. Thank you again. It's been a privilege to talk to you.
Thank you for your remarks, Dr. Corey. And more importantly, thank you for the work that you and other researchers, scientists, and healthcare providers are doing to help develop and deploy a safe vaccine for our communities across the United States. I'm going to take a little breath. I'm hearing that Governor Lewis is on. And so everybody, we're going to continue on with our program. This is, I'm kind of nerding out. This is my kind of information. This is the kind of work that we do at the Intertribal Council. And so I hope that you're getting as much out of it as I am. And so with that said, I'd like to invite Governor Stephen Lewis of the Gila River Indian Community to share his remarks. And if he has time, and if there is time, we have 1 or 2 questions for Governor Lewis as well. So I will turn it over to you, Governor Lewis.
Maria, thank you. And thank you to all the speakers prior. Thank you to the Blue Cross and Blue Shield for making this happen. Skugtas, Shamai Masma, everyone. How's everyone doing? My name is Stephen Rowe Lewis, Anyan Anapchugat, Stephen Rowe Lewis of the Gila River Indian Community. The governor, I'm proud to be the governor of the community. We are 531.2 square mile reservation. We're located along the southern boundary of the Phoenix metropolitan area, our current reservation. The community is made up of nearly approximately 23,000 community members, and 15,000 of our members are located on the reservation. The community also operates a 10-facility healthcare system that we run independently of the IHS. And I want to thank Rear Admiral Wiaki, IHS. You know, the federal government has a trust responsibility, because we're sovereign nations, for providing healthcare. And that's because of the long history between the US government and tribal nations. You know, our relationship, as we all know, predates the Constitution, predates the founding of this United States. So when we look at this unique relationship between the federal government and tribal nations, it's not just special and unique. As a tribal leader, elected by my people to lead, this is a sacred responsibility. And again, I want to thank Rear Admiral Riaki for being a very respectful partner with tribal nations. It hasn't been always that way in the past. And as we look toward the future, as we look toward a new relationship with the federal government, with the incoming administration, I share the sentiments of many of my tribal leaders across Arizona, across Indian country, that we will have a very protective relationship, respectful relationship moving forward. Now, given all of this, the community's location, the size of our membership, the large land base, the hospital facilities that we run independently of IHS, that we run ourselves as a self-governed, self-determined nation, we knew immediately that we needed to have a multifaceted approach to the COVID pandemic. Now, unfortunately, in Indian country, we are not unfamiliar with the impacts a pandemic can have on our community. You know, in the earliest days of this country, as I said, we're very harsh on our tribal populations. And those stories, those collective stories, and those lessons remain with us today. So in February, in the earliest days of the pandemic, the Gila River Indian community, the people, the leadership, all of the stakeholders, we pulled together. We pulled together and I convened a COVID-19 task force. In fact, it wasn't even in February, it was in January when I actually brought this task force together, comprised of critical departments that we knew we needed to address the coming health and economic crisis. We included departments such as, again, our Gila River healthcare systems, our tribal health department, the emergency services departments, including our first responders, our police, our fire, our community enterprises, our tribal education department, and of course, our community council, our 17-member community council. We also made sure to include an elder representative and a youth representative to make sure we could facilitate communications to those two important groups in the community. The COVID-19 task force met consistently every day in the beginning, to where now we are meeting at least 3 times a week. The meetings are away. These are through the incident command structure. These are daily briefings to keep everyone communicated with on the same page. Because as we know, this pandemic changes fast, rapidly, and we have to change. We have to be ahead of the curve. That's always been a challenge. Things change monthly, weekly, daily, sometimes hourly. So these meetings are a way to assess the prevalence of COVID in our community, as well as our ongoing, changing, evolving response to this healthcare emergency. You know, this allows us to make adjustments in real time based on the program that we diligently put together. Testing, looking at the enforcement data, testing, tracing, and treating. So the formation of the task force was especially important as it became clear early on that there would be an absence of any real, useful, actionable national plan and approach to COVID-19. As tribal governments, as sovereign nations, again, I cannot stress more than I'm already doing. Our government to government relationship is not with the states, is not with local municipalities. is with the federal government. So when the response to the pandemic was left to the states, we knew that as a government, we had to begin to advocate for, we had to begin to act as a sovereign nation, as we are inherently. We had to really get out in front of this. We had to formulate our own plans. This led to a series on my end, pursuant to my tribal constitution, a series of executive orders early on that I issued in my capacity as governor. Now, the executive orders, I want to talk about those, because those were critical tools that kept a massive outbreak of COVID occurring in our community, that kept our community members safe, that saved lives, I truly believe. Over the course of the pandemic, I issued executive orders to govern how the community addressed this pandemic. And these executive orders covered a public health state of emergency in the community, first and foremost. A stay-at-home order that has been in place for most of the past 8 months, requiring members to remain in their place of residence unless conducting essential activities. An ongoing prohibition of gatherings more than 10 people. A mask mandate everywhere on the reservation. In fact, we were one of the first jurisdictions, tribal reservations, nations, jurisdictions in general in the state of Arizona. State of Arizona still does not have a mask mandate, sadly. But we were the first ones to issue, through my executive order, issued a mask mandate everywhere on the community. Closure of all schools on our community, including our Federal Bureau of Indian Education schools, our parochial schools, we have 2 of those, charter schools and state schools. Closed for in-person instruction, where we're doing virtual instruction now throughout our community schools. Additionally, ensuring that any high-risk employees had extended leave to make sure those with underlying conditions weren't vulnerable to transmission of the virus and had a safe working alternative. Testing for all employees of the community every 2 weeks, self-quarantine requirements, and enforcement measures if needed. And a moratorium on any new evictions initiated by our community housing department. And because we're a self-governed tribe, we're fortunate, and this is the foresight of past leaders. We have our own telecommunications company. We have our own utility authority, Gila River Telecommunications, Gila River Indian Community Utility Authority, respectively. And also a moratorium on any utility turnoffs during this time as well. And I want to note, again, the community was one of the first jurisdiction in the state of Arizona to have a mask mandate. We know that until vaccines are available, safe vaccines are available, this is our most effective way to avoid transmission of COVID as well as social distancing. So I want to go next to our testing plan. We knew that the key to avoiding a significant outbreak in the community was to come up with a test, trace, and treat protocol for our members, patients, and employees. This was a challenge. In the beginning, the community was competing, as was other tribes, for supplies and lab access, just like every other jurisdiction. Because we run an Indian Health Service funded facility, our hospital ultimately obtained an Abbott rapid testing machine, but supplies even then were limited and couldn't keep up with the demand we knew we would have to have any hope of containing the virus. So our elected leadership decided to come up with a community-wide plan. And we reached an agreement with the Mayo Clinic to process a number of our tests in a 48-hour time frame. Now remember, during that time, especially during the really rough times during July and August, it took days, if not over a week, to get testing. So truly, we had to be very entrepreneurial and look at different patchwork agreements to patch this overall protocol together for testing, this overall system of testing together. And so that first agreement with the Mayo Clinic, we were very fortunate to be able to enter into an agreement with a world-class organization such as the Mayo, and to really be able to run a number of COVID tests within a relatively short time frame early in the pandemic. And as we entered into an agreement with Steward Healthcare Systems to conduct tests for our employees, we created a schedule to rotate testing throughout each of our 7 districts. And employees and elected officials are tested every 2 weeks. So those testing that we continue to do even now throughout our 7 districts, that's also surveillance testing that we conduct, that any community member, any resident within our community can present themselves at this rotating schedule throughout our 7 districts of our communities to be tested during our scheduling, where we have every week we rotate throughout our districts. So we have the surveillance testing that is done through our Heath River Healthcare, and then we also have with Steward Healthcare Systems, we are doing testing of all of our employees as well. So utilizing this comprehensive testing program, the community has now conducted over 127,000 tests. Our testing program, with that number of tests, makes up approximately over 5% of all the tests conducted in the entire state of Arizona. This testing protocol has helped us truly contain the virus in the community. But this is a pandemic, first and foremost. There's no way to keep the virus out totally. And I'm sad to say, as of today, that we have lost 30 community members to this horrible virus. Each of those community members were valuable to the community, and their deaths ripple throughout the community. These are losses that will stay with the community for a long, long time. Now, as of yesterday, we have a total of 1,160 members of the community who have contracted COVID. And like everyone else in the state and in the country, our numbers have spiked since the beginning of November. The largest number of cases in the community, I want to bring your attention to this, are those between the ages of 20 to 44, followed by those less than 20 years of age. Now, our elders, those 65 and over, represent the smallest number of cases. And I think that's because our elders have followed the stay-at-home orders carefully and have remained vigilant. And I thank them for their leadership, for their modeling, for doing this. Now, I just received a report from the community's tribal health department. And as I do every day. And this part of the data that we use to adjust our COVID response plan is very critical as we make decisions. And I also use this data to communicate directly with the community as well. I started with a series of video messages to my community. And also we put this in hard copies through our tribal newspaper as well. So communication Communication has been critical during this pandemic. I knew it was important to provide consistent, transparent communication with the community, whether it was bringing hopeful news or bad news. Our people deserve to know the truth. And on the flip side, I knew that our people, from our elders down to our youth throughout our community, could handle this, the truth as well, could handle the good news with the bad news, to inform them, to educate them, because these have been unprecedented times. There have been a good deal of misinformation about this virus in the mainstream media, on social media, in our news, from prevention measures and about whether and how soon the virus would diminish. And so that made my communication to my community members that much more important. In order to ask them to make sacrifices, to stay at home, to wear their masks, to not gather, which is so foreign to our community, to Indian people. To do that, I needed to be completely honest with the community about our efforts and the status and state of affairs of the virus in our community. So the COVID-19 data report is available publicly, so every community member can see the numbers of cases and the trends. So starting in March, I also, again, as I said, I started recording video updates to the community. First, I did daily reports, and now they are weekly and more often as they are needed. In those reports, I provide a COVID update of the numbers and the trends in the community. And I inform the community of our efforts and what they need to know about staying at home, school closures, testing, and now vaccinations. We also have had town halls with our elders to make sure, virtual town halls, to make sure that they have the latest information. And our youth council is going to have a webinar this month to make sure that our youth are informed of what it will take to remain safe during the holidays. So we'll continue these communications until we have vaccinations and can return to a level of normalcy in the community, hopefully soon. Now, with vaccinations, I mentioned vaccinations. We are very hopeful that we're getting close to a time when the entire community can be vaccinated and we can all return to work, school, family gatherings, and travel. And I've also been in contact with the Indian Health Service, the state, and the Biden transition team all in the last week to make sure that the Gila River Indian community and other tribal communities are not left out of this vaccination plan. And as I wrap up, while it may not be intentional, if we are not in front of the decision makers, Indian country can sometimes, and we've seen that, be left out of the discussion. So I have made it a point with my council supporting me to advocate strongly for vaccinations in the community, because we need to make sure the entire reservation is accounted for in any distribution plan, and all of Indian country as well. Because, Indian country, tribal people, we've been especially hit. We've been the hardest hit by this pandemic. We have the highest number of cases pro rata in the country. I've been in constant communication with my fellow tribal leaders, and we share information about best practices, so we have the best chance of keeping our community safe. But there has been heartbreak throughout Indian country as well. Not a day goes by I don't hear stories about losses in our community and tribal communities across Arizona and across Indian country. My fellow tribal leaders in the plains right now are facing an especially dark time. This pandemic has highlighted the struggles that we have faced for a very long time. And unfortunately, the underlying health conditions faced by tribal people are those that are exacerbated by this virus. At the Gila River Indian community, we have the highest rates of diabetes in the country. And so that historic lack of investment by the United States in our infrastructure has made the virus worse and also has made solutions incredibly challenging. Maria.
Thank you. Thank you so much, Governor Lewis. What you're describing is almost like trying to rebuild a ship while you're going along on the ocean, with having to just jump in and develop a plan, trying to save lives, prevent the spread, but still trying to move forward and messaging to your communities. And we're getting a lot of responses in our Q&A box where people are thanking you as a leader and thanking you for taking such swift action to address and respond. I don't know that you signed up for this when you became a tribal leader. I don't know that any of our tribal leaders signed up for this. And I see people are questioning and asking what ITCA has done lately. Well, I have to tell you, ITCA's programs and services already are in alignment with what needs to be done during a pandemic. And so through our 68 staff and our 45 multi-million-dollar federal grants and contracts, we were able to increase the efforts of sending out PPE and equipment and food and everything out to tribes, and working very closely in partnership with our tribal leaders. So I'll take some time to respond to more of the questions on the Q&A box, but right now we do have a couple of questions for you, Governor, if you have a few minutes. These were submitted by tribal leaders a little earlier, and some from community members and some from health workers too. So do you have time, Governor, for a question or two?
I do, definitely, yes. This is well worth the time here, Maria. Yes, to share whatever I can, yes.
Thank you so much. The question is, after having gone through such a serious public health threat, we see the need for more American Indian students to enter science fields and STEM careers. Do you agree with that? And if so, what are some of the ways Gila River is introducing students from your community to STEM careers?
You know what, that's a great question, and I definitely agree. In fact, when I tell my youth, because we are the people of the river, and we were, we proudly trace our lineage to the Hugam civilization that, of course, modern day Phoenix sits on. All of those modern canal systems, those are built on the original thousands of years ago that were built and engineering marvel from those, from the Hugam civilization that brought water. So the hydrology and the engineering technology, that's science, and that's in our DNA. And I tell our community member, our young people, never betray your DNA, your bloodline. You have science in your bloodline. And so we've really definitely, with myself, my brother, John Lewis, who's, who's in leadership and currently now with Gila River Telecommunications, working with our tribal education department, really working with our teachers, our teachers and in our schools and in the leadership. We've really come together and made a very concerted effort to introduce STEM, robotics, to introduce, these type of coding opportunities for our community members. And so, I think for tribes, looking at those partnerships as well really helps. In our northern boundary, you have one of the largest manufacturing technology plants in the world, Intel. And so we have a great relationship that we're growing with them. And, so I urge, because you look at Arizona, you look at a lot of heavy tech companies that are located here. This is something that both tribal leaders and ITCA can help to leverage to open up those communications with the Apples, with all of these, tech giants that are located in the Silicon Desert, right? Biotech, that runs the gamut. And so what we're trying to do, and as a tribal leader, Maria, since we have an incoming vice president who was the vice president for President Obama, when I was a lieutenant governor, Intel was just opening up one of the largest, one of their largest manufacturing divisions. Then President Obama came. And I had the opportunity to meet with him as lieutenant governor. And of course, Intel was maybe just less than a mile from our reservation. And I explained that to him. And President Obama said, Lieutenant Governor, you know what? If you want your children to even have a chance at working in a place like Intel, we don't want them to be mopping the floors, but actually being engineers. You as a tribal leader are gonna have to take the leadership to make sure that they're being taught the latest and greatest to provide them with a world-class education, exposing them to science, technology, engineering, and math. Have them put down the video games. But now we're seeing that video games are actually a very good gateway to introducing them to technology. But at the time, he was very adamant about that. Have them put down the PlayStation, and have them start to look at exactly, what it takes to actually code these programs and to provide them, access to those type of opportunities. What we have, and what my brother was really championing too, is STEAM: science, technology, engineering, arts, agriculture, architecture, and math as well. So tribes, we can take STEM, we can use that and draw parallels to our own value systems, to our own history, as a way to mobilize and to get our young people excited in STEM. And so those are just a few of the examples that we're using to incorporate STEM at the earliest ages to our young people in the Gila River community.
That's so exciting. Here at ITCA, and you've been here with other tribe leaders many times, and we're really, our work.
It's been a while. It's been a while. I'm gonna come back.
I know you want Ernie's, right? The chili. But, here, so many of our jobs, just like with Gila River and all of our tribes in Arizona, a lot of our future jobs and our development of our workforce really will hinder around that science background. And so I think this is like a touch point for all of us to just go ahead. We know we're good at math. I don't let anybody around me say, I'm not good at math. I'm not good at math. Just don't even say it out loud, because
Right.
we know we're good at math. Look, like you said, look at the Hohokam and what they developed and how we're all living here in Arizona because of your ancestors and all of the ancestors here in Arizona.
And Maria too. I think healthcare and public health, I think this pandemic showed that we need to put a very strong investment in that as well.
Yes.
I think for the Gila River community, we came up with an agreement with the University of Arizona to provide contact tracing support to our tribal health, and also, looking at ways where they can help our own tribal health department work on modeling and using that data to analyze the COVID statistics, so people like me as a tribal leader can make those informed decisions based on science. So we run our own healthcare system too, and we have to look at ways where we need to provide those pathways to the healthcare profession. We need an unprecedented push now coming out of this pandemic. Indian country, if not the nation, is going to be looking at this, but Indian country can take the lead. Right? Tribes can take the lead in really creating pathways and creating incentives and mobilization to our young people to go into these healthcare professions that we're going to need. We're not going to, once we go through this pandemic, we're going to come out, we're resilient, but at the same time, there's going to be more challenges, more healthcare challenges, in addition to the existing healthcare challenges, such as diabetes, heart disease, et cetera. And so we're going to need, this could be a historic time, for us to address just those issues, Maria.
Absolutely. And Governor, I just appreciate your comments, your thoughts as always. Yes, you're my boss, but I really admire the work that you do and your leadership. And we've kind of run out of time. And so we have our next presenter, but I just want to thank you for all the ways you serve as a tribal leader. It's very, very meaningful whenever we have you join us. And so thank you so much for taking the time to join us today.
Well, thank you, Maria. Thank you, everyone out there. Everyone stay safe. Again, wear your mask. Mosapa.
Bye-bye. And so right now, we're going to start to focus a little more on some of our local tribal community efforts. And so I'd like to go ahead and introduce our next speaker. We have Miss Jessica Rudolfo, and she's going to share about some of the the things that she's had to deal with in her position as Executive Director of the Division of Health and Programs for the White Mountain Apache Tribe. So I will turn it over to you, Jessica. Thank you so much for joining us today.
Hi, my name is Jessica Rodolfo. I am the Executive Director for the Division of Health Programs. I also apologize for all the back feed. I am coming to you from our Emergency Operations Center. I am a part of the Emergency Operations Incident Team here for the White Mountain Apache Tribe. So just to go over some of the things that we've done since the inception and our response to this COVID-19 pandemic. In December and January, we began watching the pandemic. In February and March, the Division of Health Programs started with weekly meetings to continue to monitor and watch how the COVID virus advanced through the world. We established our Tribal Incident Command on March 12, 2020. Early on, the White Mountain Apache Tribe established a unified incident command with our local White River Service Unit that occurred on April 8 of 2020. June was a month where we saw our highest numbers regarding COVID cases. Our Tribal Emergency Operations Center, in response to those high numbers, initiated a 2-week lockdown and back-to-back 57-hour weekend lockdowns. And resulting from these lockdowns, what we saw was a decline in our numbers. We have not seen those high numbers since that time. Our Emergency Operations Center operated daily through July and August. So that included for us even on included weekends for us. When we established our Tribal Incident Command on March 12, our CXR director was appointed to the EOC Operations Chief in the EOC infrastructure. This improved our service response immensely to our community. We were able to then establish an alternate care site, an isolation and quarantine site. We didn't understand initially what this would entail. We were very fortunate that one of our departments, our local Rainbow Treatment Center, who provides substance abuse care to the community regularly, had undertaken this task. One of our strongest connections to this response was our response with our White Mountain Apache Tribal Council. They were able to meet with us and pass many of the policies that affected our tribe. We had established a mask mandate throughout the entire tribe that masks must be worn everywhere, as well as implementing policies that created staggered work schedules for our workforce. We created policies that supported our essential service departments. We limited our cultural events throughout the community, as well as limiting all events that had more than 10 participants. We stopped all the selling and the sale sites that occurred on our reservation. And a lot of the things that we did throughout our community. And as you can tell right now, I am coming to you from, as I said, our emergency operation. We have our planning chief, we have our incident commander, we have our finance specialists, our PIOs, as well as our operations chief, our policy unit, and our logistics department and our safety department. I myself am currently assisting the EOC in the liaison status, as well as being a director, the executive director director for the Division of Health Programs. So a lot of what we do on a daily basis is we've spent the past 8 months in this room with each other, and up until July, we didn't have any weekends at all. So, and as you probably were able to see, that there were boxes in the background. This serves as a storage unit. We don't have a lot of availability in our rooms and where we might operate. So what we ended up doing was borrowing this room from our local fire department. So in conclusion, when we look at how we did what we did here for the White Mountain Apache tribe, it was because we had so many departments step up to the plate. These departments stepped up with an attitude to serve. They came to the table. They wanted to participate and they wanted to be a part of the solution for this pandemic. We've encountered so many adverse events during this pandemic. We've run out of water. During the lockdown, we've had people, the streets were completely empty. One of our strongest responses to the pandemic was our contact tracing and surveillance team. What they were able to do was go out to our community members and identify those high-risk patients and identify high-risk community members. We've come upon situations where we have encountered people in the community who had very, very low oxygen levels, and had our CHRs not gone out there, we would maybe have had a higher rate of loss within our community. But in this event, in this response to the pandemic, one of our biggest saves was through our CHR departments. And I know that the funding is regularly, yearly is on the chopping block to be cut for the services. And annually we have seen a decline in services. And right now there is a lot of push for being able to reimburse for the services that the CHRs provide. Well, in this event and in this pandemic, the reason why we have been able to save a lot of the lives of our community members is because of our incredible CHR team. I just want to say thank you for inviting me to be a speaker at this town hall. And I want to let you know that I appreciate the work that is being done throughout the community. I also appreciate what everyone else is doing and the interest in our work. But I do want to mention here at the end that, like I had said, a lot of people ask us what our secret is for the success that our tribe has faced. And when I really look back and I think about it, it's that everyone stepped up. Everyone wanted to serve. They were here. It made it easy. It made it easy that our tribal council was here. It made it easy that our IHS service unit were here, and all the departments came out. And the people that I showed you here in this room, they are representative of departments. We're not in our positions that we were in before we came into this room. We came from housing, we came from the treatment center, we came from our client business our business office, we came from CHRs, we came from our treatment centers, and a lot of our departments that are here in this room right now. This isn't our regular job, but this is the job that we do all day. And as you can probably hear by all the commotion that's coming in, that it never ends. It doesn't stop. And we are very service oriented, and we want to be here. We came here to serve, and I myself am a veteran of the United States Army. I served my country, and now I'm in the capacity to serve my people, and I do the best that I can with what I have every single day. So thank you so much.
Thank you. Thank you so much, Jessica. First of all, I want to thank you for your service to the United States. My dad and 5 of his brothers all served in the military. And so I believe that that spirit of running toward a challenge like a pandemic probably comes from your experience serving in the military. Yeah, it's amazing. I got goosebumps. But I want to thank you so much for your dedication and the work that you're doing. We will let you get back to work. You're there at the command center, and so thanks for sharing what you have done to combat the pandemic for on behalf of your tribe. And we look forward to getting through this and coming back and being able to hear how everybody's doing and hoping everything is moving forward. So thanks again and enjoy the rest of your day. And please stay healthy and stay safe. Thank you, Jessica.
Thank you.
Okay, everybody, this has just been a very moving day for me, and I just thank everybody for hanging in there. This is such important information, and just everybody taking the time and sharing and having these discussions will help move us along and help us hang in there during this most challenging time. So as we approach our final portion of the Tribal Health Town Hall, I'd like to everybody just keep in mind that we are, I know it sounds corny, but we are in this together, and hang in there. I know it's very challenging mentally. We're seeing a lot of illness and we're losing loved ones, but hang in there and just know that we are in this together. And so with that said, I would like to invite our next speaker to please come and share remarks. We have Dr. David Wilson, Director of Tribal Health Research Office for the National Institutes of Health. I'll turn it over to you, Dr. Wilson.
Thank you, Maria. Really appreciate the opportunity. And you put me in an awkward space. I'm between all the attendees and lunch, so I'm going to try to wrap up on time. So good morning, or good late morning, tribal leaders and tribal health professionals. It's a pleasure to have the opportunity to speak to you today. There's a lot going on, and you heard a lot of really important remarks made previously by the previous speakers. And so what I'm going to try to do is I'm going to try to incorporate some of what we've heard this morning into some of the things that we're trying to do nationally to address the COVID-19 pandemic. So here's our title slide, and we'll have more information on the back end if you want to get a hold of me. So next slide, please. So this is something that we are all faced with right now. And this is actually a heat map of COVID-19 cases last week. And I'm really, really uneasy about looking at this week's map when it comes out, because as we continue to hear, the cases are just continuing to accelerate, and they're really pushing the boundaries of our healthcare systems. And so it's really important to think about how we can help end this pandemic. And so at the NIH, our mission is to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, reduce illness and disability. And with that, we're trying to accelerate the development of a vaccine so that we can protect those who are most vulnerable in all of our populations. Next slide, please. So we get a lot of questions about how does a vaccine work, and what does it actually do in our bodies, and so we really like to illustrate and show this slide because a picture is really worth 1,000 words. On the left here, you can see that this is an image. It's a very nice image of a coronavirus, and the little thing in the middle here that looks like it has 3 little arms is what's called the spike protein, and a lot of people refer to this as the landing gear for this virus. This virus has to have this intact landing gear to be able to bind to our human cells. It actually seeks out, and it has a very good fit to something called our ACE2 receptor. Something that's interesting and really important to acknowledge is that the virus does not discriminate. We all as humans have this ACE2 receptor. And so it doesn't discriminate on how rich you are, how many cars you have, where you live. All of that, the virus doesn't care about. What it cares about is finding that ACE2 receptor and binding to it. This is its mechanism for entry into our cells to create and cause infection. And so it's really important to think about this. This virus does not discriminate. And, unfortunately, we've been having a conversation about if we were to come in contact with the virus. Well, it seems more like that is a question of when we come in contact with the virus. And so thinking about vaccinations and therapies, it becomes even a more important discussion as we move and progress through the end of this year into next year. Next slide, please. So as Dr. Corey had talked about, and Dr. Corey is a fantastic person. I'm really happy that we had the opportunity to hear him this morning. He and I work very closely together along with Operation Warp Speed. Our focus, or my focus, is to make sure that tribes have as much information as possible so that they can make that informed decision on whether they choose to participate in these opportunities called clinical trials, whether they be vaccine trials or whether they be the vast number of therapies that are being developed. So therapies are being developed in terms of antiretrovirals, but also monoclonal antibodies. And I think some folks have heard about those on the news. But I think it's really important here to see that there is a variety of vaccines that are in development. And it's really important because we weren't sure exactly how this virus would react to these different platforms. So you can see here, what we've been doing is communicating how each of these platforms works. And I've given lots of presentations to many different tribal councils and the tribal health departments to better help them understand how each of these different platforms work, function, and how they produce immunity towards the COVID-19 virus. But I think more importantly is that we have to think about the capacities. There's a lot of issues related to cold chain storage requirements for these different vaccines. And so having 22 of the tribal nations in Arizona live in mostly rural areas, and knowing that the the Pfizer vaccine, which is an mRNA vaccine, requires minus 80 degrees centigrade storage at all times, and living in the desert, that could be a problem. And so it's really important to understand what are the storage requirements and how do each of these vaccines work. People also talk to us or ask us now, Dave, that there is 2 products that are now going through the emergency use authorization process. Should we stop thinking about participating in clinical trials? And I think that is a question for each individual who's thinking about the virus, but there are so many unanswered questions that we still need to answer around these different products that are being produced or that have been produced and are currently in phase 3 clinical trials. We don't know about the durability. How long do each of these vaccines last and provide protection to our bodies? Some of the other things that we don't know is that because we get immunized by each of these different or one of these different vaccines, is this going to actually provide us, or are we, after we become vaccinated, are we no longer carriers of the virus? Because as you know, that a vaccine will actually ready your body to recognize the virus landing gear or the spike protein. So when you come in contact with that virus, your body can really ramp up your immune system really quickly so that you avoid the more severe outcomes of prolonged infection. But during that short window, when you do come in contact with a live virus and your body is ramping up its immune system, are you infectious? And that has a lot of consequences for those in our families, in our multi-generational households who have not been vaccinated. So these are really important things that research in time will tell us. But still, I think it's really important for us to really consider, what this means and how this works. Something that Rear Admiral Ryaki discussed is the operationalizing the vaccine distribution. And one of the things that Dr. Corey and I, always talk about is that it's important to think about that vaccines don't save lives. It's actually people taking vaccines are what save lives. And so if we produce and we get all the vaccines distributed into all the different tribal communities, we have to make sure that our community members have full faith and believe in the efficacy, the safety, and the benefits of this vaccine before they take it. So how are we doing that? A lot of this is through dissemination of information. We really want to show or to describe to all of our community members, you see on the picture here of the little vial, we've got that question, what's in the little vial? Well, through these presentations and through community engagement, we can talk into a varying level of detail of what's in the vial and how it works. And what you see in front of you are some of the community developed slides that have been very useful for us moving forward to help provide clarity on what this looks like and how it's going to work in our bodies. A lot of questions about I don't want to have a vaccine intercalate in or incorporated into my DNA. So through these processes, through these descriptions, we can tell these community members that that is not the case. And also you will not become infected if you take a vaccine, because these vaccines are developed by producing large amounts of a single part of that whole virus. Just the landing gear, just the spike protein is what our bodies are being exposed to, so that we recognize that immediately. We develop antibodies toward it, and those bodies will actually encapsulate or bind all of those landing gear spots, thereby neutralizing these viral particles, thereby the term neutralizing antibodies. Next slide, please. So showing you the multitude of different platforms that are available. Here you can see the end game, or the ultimate goal is to develop those antibodies so that we can bind up all of those different parts of the landing gear, or cover the spike protein so it's not able to recognize and bind our ACE2 receptors, thereby mitigating its ability to cause infection. So next slide, please. So I think that we've heard a lot about, the Moderna studies and the AstraZeneca and Pfizer, and it's really important to think about diversity and inclusion in terms of clinical trials. And here is the Moderna. After the completion of their enrollment studies, they put out some graphics to show what the diversity of their participants look like. And Native Americans actually are captured in the all others. Surprise, surprise. I think that that's sometimes how we're always classified. But having said that, this group, I believe that Native Americans comprised about 0.5% of this study. And so that equated to 175 tribal members that participated in this particular study. Next slide, please. Something else that we heard about were the Pfizer study. We've heard a lot about this. The EUA is in progress. This study has actually done a very good job of diversifying the number of participants in its study. So here you can see Native Americans in the overall study are 1% and 1% in the US study. And so this, if we do the math, it's around, almost 500 participants. And so that is a pretty good representation, a pretty good sampling size for tribal communities. But I want to say that it's important for us to recognize, and Dr. Corey brought this up, is that our communities have a history with research, and not all of it is good. And we understand that. And I think that this is the first time that we've really, at the NIH, have really made a full-on huge effort to include tribal communities in these conversations. So again, our end goal was not to include or look at the numbers in terms of how many tribes participate in these clinical trials. Our end game was to provide tribal nations with as many tribal nations as possible with the opportunity to exercise their sovereignty and make that decision on whether they think that these studies are appropriate for their citizens. And I'm happy to say that many communities have made that first step. They have decided to participate. And so we are robustly and actively engaging those communities. One of the things that I can happily report is Governor Lewis, Governor Lewis had talked about the Great Plains area. Well, through a collaboration, we've been able to set up 2 clinical sites, one in Rapid City and one in Eagle Butte, and they will both be offering, one of them will be offering the Novavax protein vaccine, and the other will be offering the Sanofi, which is also a protein vaccine. But in addition to that, they're going to be offering monoclonal antibody treatments. So if an individual is diagnosed or it has a positive result, they have 72 hours to enroll with this study and receive the monoclonal antibody treatments, very similar to what the president received when early on in his stage of infection. There's some promising results, I should say, around the monoclonal antibody treatments, but it's another opportunity for communities to help better their conditions, better help support them to meet the needs during this global pandemic. Next slide, please. So I encourage all of you who are on the call today or the meeting today to, if you would like more information about all the work that Dr. Corey is leading and that we're working on within the Tribal Health Research Office, go to this website. It's the coronaviruspreventionnetwork.org website. And there's also an opportunity that if you are thinking about, participating in these trials, you can get as much information as possible through the FAQs, kind of what to expect, and all the different studies that have completed enrollment, but are also those that are beginning to launch. Next slide, please. And also, if you want to hear more, or if you have more questions about the work that we're doing for tribal communities, please feel free to reach out to me directly. I'd be happy to answer any questions related to all the work that we're doing in response to COVID-19 with tribes. And we're looking forward, I'm really looking forward to going back and being able to interact with ITC again. We've had a lot of terrific engagements, and Governor Lewis and I have met several times. So I'm looking forward to being able to do that again, because I do think that there is a real opportunity here for the NIH to provide training opportunities to tribal members to help prepare them for the next pandemic. As Dr. Corey said in his remarks, this is, as our populations continue to grow, more rocks are being overturned and more human and animal interactions are occurring. And that has the potential to lead to more emerging infectious diseases. So with that, I would like to stop and entertain any questions that we may have. Thank you.
Thank you. Thank you so much, Dr. Wilson. This has just been phenomenal. You really broke it down so that we could understand and really see where we kind of fit in the continuum as the United States and scientists such as yourself are working to develop and deploy the vaccine. You are such an excellent scientist that you literally answered the questions in your presentation. Let me see, I think we do have, everybo's just, saying thank you to you on behalf of your work is what I'm seeing. But one of the things I had many years ago had the chance to meet Dr. Clifton Poudry, who also worked at NIH. He's Seneca Native American scientist. And he's the one who really started talking to me. At that time, I was directing the WINS program with Native American college students in DC for the summer, talking about the effects of medicine and how they affect people differently. And so with the vaccine coming out, is there certain messaging that tribal leaders should sort of use when introducing this idea that we're going to have a vaccine? It's been tested with Native Americans participating in the clinical trials, and we should feel safe. Do you have any thoughts about the messaging around that?
Absolutely. I believe that community engagement and community leadership, whether it is through tribal leadership or it's through our traditional healers in the communities, they are going to be absolutely critical in encouraging and I hate to say persuading, but getting individuals to think more openly about the benefits of receiving a vaccine. And without that, it's not going to work, and the communities will not benefit from the science that has really, I think, been a phenomenal feat. In 11 months that we have been able to develop not one, but 3 vaccines, and 2 of them being so highly effective that people in the HIV community who've been doing this work all their lives have been shooting for a bar of 50%. Hearing about 95%, 90%, it's just a dream come true, you know. And so far, the side effects really haven't um, been that bad, you know, in terms of what people have been reporting. So I think we need to think about um, if there's a 95% chance of me not going to the hospital, being intubated, and possibly dying, would you take that risk? And I think that that's the message that we should deliver.
That's excellent. Well, I believe that concludes your presentation. I just want to thank you so much. ITCA appreciates our partnership with you and the NIH, the Indian Health Service, and all of our partners so much. But we really take our hat off to you and admire your dedication and your service to all tribes. And I'm sure your work goes beyond working with tribal communities and the role that you serve. And so we just thank you so much and look forward to having you back out here in Arizona soon. It's not very warm right now, but you know, maybe after the pandemic it'll warm up and you can come out and visit us.
I think it's a little warmer than it is here in DC.
Yeah,
But I also would like to put in a plug for this Saturday. I'm going to be joining Chairwoman Gatewood on her Saturday morning show. And so if you want to continue the conversation, you know, please sign up for that. And, you know, we can continue. If there's a question that you didn't ask now that you want to ask on Saturday, you know, we can do that.
I think we have one last question. If you have a moment, I'm sorry, it just came in and it says, is NIH or any of the other institutions studying longer term convalescence care and support for COVID-19 survivors?
So yes, and I believe that the term that has now been coined are the long haulers. And that has been, yes, and that has been an emerging area of concern at the NIH because we've been seeing more and more reported incidences of those individuals having a variety of carrying over symptoms, you know, from the infection. So it is definitely something that will be in the works for future research.
Excellent. Well, with that, we just want to thank you again, and you can enjoy the rest of your day. I know that you're going to be working probably through the weekend, but we appreciate you, and thanks again for joining us today.
Thank you very much.
Thank you.
Okay, bye-bye.
Well, everybody, we are coming to that time of our program where we are about to end. But I just want to thank everybody for joining us today and thank you for your comments. We will continue to answer the questions that are in the Q&A box over the next few days. And all of those answers will be located in a landing page that Blue Cross Blue Shield will share that information with us. You will receive an email on December 7th with the event satisfaction survey. It'll be a link, and if you could please complete the link and let us know how we did today. It's nerve-wracking doing these kinds of events, but it's just part of what we wanted to bring to you today. And so we just want to thank all of our speakers, all of our participants. The speakers will receive a small gift in the mail, and of course, all of you for attending. Thank you for the work that you do every single day. When you registered, that entitled you to receive a small gift, and that will come out in the mail, and I think you'll really enjoy it. It's something to keep you safe and serene during this challenging time. So with that, I'm going to say goodbye once again, and thank you all. Stay safe and stay healthy. Bye-bye.